What's up YouTube? Hype23 here, and this is the part 2 on how to build your IFAK. If you haven't seen part 1, check out the link in the description. But I'll just get back to where we left off on the first video. Next up, you're going to need a pressure bandage. These have multiple uses other than just applying pressure to a wound after you've stopped the blood flow. You're going to want to use hand pressure until the blood is stabilized. Then you can apply one of these pressure bandages and then move on to a different person if you need. These are the Israeli. This is a cheap 3-inch, very small compression bandage. I don't know how effective that is. And this is the Olay's modular bandage. I already opened it because I was experimenting with it. The Olay's and the the Israeli bandage are the two I'd recommend, one of those two. You can get them in 4 or 6 inch. And they both have different features. With the Olay's, you get a couple more features. You can actually pull gauze out of it, and there's a piece of plastic inside. But they both have a different means of applying pressure. Next up, we got gauze and hemostatic agents. Still focusing on blood loss here. Hemostatic agents, we got quick clot combat gauze. It's probably arguably the best one if you can afford it. It's also the most expensive. It's just gauze folded up and soaked in the quick clot hemostatic agent, so you can pack wounds with this. For less money, you can also get clotting sponges. These are also pretty good. You're not going to be able to pack wounds, but you can apply pressure with them. And also not shown is granules, which is just an agent in little pieces. You rip open the pouch and you just pour it straight on the wound. So those are some options for hemostatic agents. Gauze. Gauze and gauze. Have as much gauze as you can carry in all different form factors. It's going to allow you to treat multiple injuries or multiple people. If you can afford it, carry multiple combat gauzes. I usually carry one and then just some extra gauze. This is an H&H compressed gauze. Brick. Got brick. Here's a North American Rescue compressed gauze. Here's a Z-Pack dressing. It's quite large but very flat. And you got all different types of roller gauze you can get for very cheap. Combined pads. Highly recommend to have 1 or 2 of these. It's kind of somewhat thick. Will help moderate injuries. You know, you can even get just flat Band-Aid gauze. Surgical sponges and non-adherent pads. I also recommend to have a couple of those. All this stuff over here is very cheap, so I recommend carrying as much extra as you can. Breathing and respiratory. We got chest seals, NPA, chest decompression needle. Let me go over each real quick, tell you why you need them. Chest seals, I only use this type. This is a Vent twin pack. These are vented chest seals, so they will only let air in one way. They come with 2, so if you have an entry and an exit wound, you can apply one on each side, or depending on the circumstance, you could treat multiple people. If you can, there's other good chest seals. The Halo chest seal is supposed to be very good. It's non-vented, it's a big circle. If you cannot afford a chest seal right now, I recommend carrying a couple plastic bags and some tape, duct tape preferably, and you can make an improvised chest seal with that plastic bag should you need to. The NPA, also very, very important. This is going to cover an airway. The NPA is a nasopharyngeal airway. This one is made by Rush. This is a number 28 French. So that means that it's going to cover most adults as far as sizing. So if anyone has a crushed airway, compromised airway, whatever, after you get them stable and they're not losing blood, you might want to put this in and secure their airway, then put them in the recovery. And then last but not least is a chest decompression needle. That does require training. You're going to be sticking a needle in someone's chest. You need to do it properly, but that doesn't necessarily mean you shouldn't carry one of these, because there may be other people on site that are trained. So it's not always, and a lot of this is meant to be used on yourself, though you can use it on others. So if someone else is treating you and you have a sucking chest wound, the chest seal is going to help with that. But if you have a tension pneumothorax, like if it gets too bad and you get to a tension pneumothorax, then you're going to need something to actually relieve the pressure, and that's when this is going to come into play. So chest seals, NPA, must have. This is up to you if you want to carry it or not. And you know, it's recommended, I recommend you get training on all this gear, but this one specifically, get training for. Lastly, everything else you need to consider putting in your kit that I haven't gone over yet. First up, gloves. Must have. These are made by North American Rescue. They have a tactile fingertip, so if you get covered in you know, fluids, then you'll still have some dexterity in your fingertips. A Mylar space blanket. These are very cheap. You can also get more expensive, nice ones, but at least have one Mylar space blanket. Sheesh, I can't talk anymore. It's going to help control the temperature of somebody and stop them from going in shock or help them with shock. We got tape. Carry medical tape and duct tape. Antiseptics. It's up to you if you want to carry these. This isn't going to do much for a big wound. You can carry a vial of this, but your first priority isn't going to be infection. That'll be secondary care. Your first priority is stopping blood and stabilizing the person. Also, a face shield is good to have if you're going to perform CPR and you don't want to touch your lips to their lips. Ace bandage has many uses. Triangular bandage also has many uses. So these are also things you should have in there. I also recommend keeping a small medical kit for very minor injuries. Alright, real quick, 2 things I forgot. These are very important. Shears. You can get very cheap, get very expensive. There's all different types. You can also use a knife. though it is more likely you're going to stick somebody with a knife. These have a rounded tip. Go cut off clothing to get to the source of the wound. And hemostats. You don't really need these. Probably not going to help much if you don't know how to use them. But you can carry these, and that gives you the ability to clamp off an artery if you can find the source. So just two things to consider. Alright guys, we got our IFAK finished. I'll just go over it real quick and then end this video. Got some shears, some tape in this pocket. Got our gloves, medical tape, compressed gauze, face shield, combat gauze, cat tourniquet, decompression needle, NPA, hemostats, just because, combined pad, non-adherent pads, chest seals in the back, and I got a couple small bandages over here. So that's the IFAK. Hopefully you guys learned something, got some ideas. Please share, comment, like, whatever you might want to do. I'm going to work on trying to get some better camera equipment. So thanks for watching. Hype 23 signing out.